Hello, my name is Jose Rodriguez. I'm an internal medicine resident at the Aventura Hospital. I'm going to be presenting a case report titled A Case of Acquired Double Pylorus Due to Peptic Ulcer Disease. So double pylorus, or DP, is a rare endoscopic and radiologic finding that can be acquired or congenital in nature. Its acquired form is generally associated with ulcerogenic drugs and H. pylori infection, which are common risk factors for developing peptic ulcer disease. We are presenting today a case of DP in the absence of these common risk factors. Our patient is a 61-year-old male with a history of chronic lymphocytic leukemia in remission who was admitted with a diagnosis of pulmonary embolism. The physical exam showed epigastric tenderness. The patient denied any use of NSAIDs or corticosteroids. The patient was evaluated by the GI service for concerns of increased risk of GI bleed due to newly started anticoagulation therapy in the setting of iron deficiency anemia of unknown etiology. The EGD was positive for mild antral gastritis, 2 small superficial antral ulcerations, Forest 3, and a deformity of the pylorus consistent with a gastroduodenal fistula. The lumen of the fistula was described as irregular, small, and with a short tract. The biopsy showed atypical glandular proliferation with acute and chronic inflammation and a negative H. pylori immunostaining test. The patient was started on PPI, twice the BID, with outpatient follow-up. So double pylorus is a rare endoscopic finding, as we mentioned before. These abnormalities generally associated with peptic ulcer disease, and less commonly, it might be the result of the abnormal recanalization of the stomach during the embryonic development. DP can present with epigastric pain, nausea, vomiting, anemia, melena, hematemesis. However, in most of the cases, it's an incidental finding. The most common acquired forms result from a gastric ulcer that has eroded and created a fistula between the lesser curve of the stomach and the duodenal bulb. The treatment of this condition focuses on addressing the peptic ulcer disease with PPIs therapy. There is less than 10% chance of closure of the fistula with treatment. In our patient, the presence of leukemia with tobacco use predisposed him to develop mild antral gastritis with 2 superficial ulcers. Our case highlights that regardless of the severity of the peptic ulcer disease, the presence of H. pylori infection, the use of NSAIDs, or the lack of these factors, the long-term ulceration of the gastric antrum and the duodenal bulb can cause the formation of a fistulous tract that ended up forming a DP. A DP, so we can conclude that that we have theorized that the chronicity of the gastric ulceration carries a larger risk for the development of DP when compared to the severity, coexistence of H. pylori infection or NSAIDs use. Although DP is usually associated with these ulcerogenic drugs and H. pylori, any etiology of long-term inflammation of the antrum, pylorus, or duodenum could potentially cause it. Thank you so much for your time.